To get things started, we have our first presentation, which is Arizona and Utah, a roundtable panel discussion on rapid response practices. I think that all of our presenters are here. If you guys could, please turn on your cameras and try to remain on camera throughout the presentation if possible. So for this panel, we have 5 entities that are representing their foodborne outbreak response units and RRTs. Rapid response teams are multi-agency, multidisciplinary teams that respond to food outbreaks and emergencies. By facilitating communication between agencies and coordinating their response, they can help to increase the speed and effectiveness with which food safety professionals are able to respond to foodborne illness outbreaks. Today, on our panel, we have the Arizona Department of Agriculture. We have representatives from Pima County, Maricopa County, Utah Department of Agriculture and Food, and of course, the Arizona Department of Health Services. So let me see. Let me make sure everybody's on camera. Oh, looks like Pima County has a little group there. That's great. All right. So our first question is, and throughout the presentations, if you guys do have any questions for our panel, again, please put those into Slido so that we can go over those as a group at the end. So our first question, can you please briefly introduce yourselves, your team, and describe your role within your rapid response system? We'll start with the Arizona Department of Agriculture.
So good morning, everybody. My name is Jill Miller. I am with the Arizona Department of Agriculture within their citrus, fruits, and vegetables. It is a relatively newly established role within this federally recognized rapid response team. It is that our responsibilities are really to meet those FDA grant goals at the moment. There's quite a few that we have over the 3 years that we have it. But more on the agricultural side, it is coordinating our divisions in response to human animal food. So that's in our citrus, fruits, and vegetables, helping with produce. Within our animal services division, their meat, egg, dairy, and then any of our agency emergency response. And then in our environmental plant services, specifically animal feed. But that's for me.
Awesome. ADHS? Oh, you're muted.
Oh, sorry. Can you hear me?
Yep, all good.
Okay, awesome. Good morning, everyone. My name is Reshma Nupane, and I'm the Food and Waterborne Disease Epidemiology Program Manager here with Arizona Department of Health Services. And I also supervise the wastewater surveillance program here. So our program falls under the Office of Infectious Disease Control, and then which is under the Bureau of Infectious Disease Services, and that is under Division of Public Health Preparedness. And our program's role, and my role within our rapid response system, is to conduct surveillance of food and waterborne disease here at the state. And we also conduct about 20 surveillance for about 25 diseases, so salmonella, Shiga producing E. coli, which we commonly refer to as Aztec, botulism, just highlighting a few there. And then we also work on responding to HABs, which is also known as harmful algal blooms here in Arizona. So just wanted to mention a few of what we surveil for. And we work on responding to outbreaks as well, right? Gathering that data, analyzing the data, making sure we analyze that data to identify trends, monitor any increases of cases within the state. And in addition, we also communicate, coordinate, collaborate with our internal and external partners. That's including our ADHS environmental health team, our Arizona Department of Agriculture partners. We also have our local health, epidemiology, and environmental health partners that we collaborate with, and definitely our federal partners, CDC, FDA, USDA as needed, and then, when appropriate. And then furthermore, I wanted to kind of add also that we work on conducting trainings, developing tabletop exercises that we've done definitely in the past, and investigations. We develop protocols, any sort of resources that is related to outbreak response, and definitely, work on improving and enhancing resources that we already have developed. So I think that's a brief overview of what we do here at ADHS.
Fantastic. And then our guests from Utah.
Okay, can you hear me?
Yes.
Okay, I'm Thane Mickelson with the Utah Department of Agriculture and Food. I have a lot of responsibilities there. About 40% of my time is spent with the RRT. I'm over Homeland Security, Risk Management, and I sit as the lead at the Emergency Operations Center for ESF 11. And then I team tag with Talisha Bacon, our RRT responsibilities, and I'll let her go into a little more detail there.
Thanks, Thane. Can you all hear me? Okay, yeah, like Thane said, we tag team quite a bit, which is awesome. And it's a lot of fun. So my name is Talisha Bacon, and I am the Utah Rapid Response Team and Recall Program Manager. We're at the Utah Department of Agriculture and Food. So what we do is we respond to a lot of foodborne outbreaks on the human and animal side, and we work really well with a lot of partners in our state. And I just want to show, hopefully this works. Is it possible to share my screen?
I believe so. Let me check.
I think if I just do.
She should be able to share it.
Okay, perfect. All right, can everyone see this? This slide?
Maybe if you could go into the full screen if possible.
Yeah, sorry. Where's the slide?
Yeah, slideshow right
I have it right in front of me. I love it when that happens. Okay, can you all see this?
Yep.
So this is our steering committee in Utah, and we're very lucky to be able to work really well with everyone. We have good partnership here in our state. But our steering committee makes up people from our health departments, our Division of Emergency Management, our Department of Health and Human Services, the FDA. We have an urban and rural health department representation, our labs, USDA, and many other partners. So this is our steering committee that we do a lot with the Utah Rapid Response Team, and we meet monthly. And this is how we're able to accomplish so much good things in Utah with all this collaboration and partnership.
Fantastic. Thank you for that.
Yeah.
And then we'll move on to Pima County's response.
Can y'all hear us okay?
Yeah, you're coming through for me.
Good morning. I am Lonnie Anderson. I'm the division manager for consumer health and food safety here in Pima County. And on our team, we focus together with our FE to very similar to ADHS in terms of prevention of foodborne and waterborne illness. I'll let the other team members introduce themselves as well.
I'm Gretchen. I'm an enteric epidemiologist in our epidemiology division. Work a lot with environmental and work on a lot of outbreaks.
I'm Anissa Taylor. I'm the EPI program manager, which oversees the enteric foodborne, waterborne illness investigations, which also works with the environmental health and our outbreaks team for our community investigations, including schools and anything going on in our community, including long-term care, other facilities.
My name is Shane Carroll. I'm an environmental health specialist too. I conduct foodborne illness investigations and respond to outbreaks and conduct environmental assessments at licensed facilities and sometimes unlicensed facilities in Pima County.
Fantastic. And Maricopa County.
Thanks, Jake. Can you hear me all right?
It's good for me.
Excellent. Yeah, my name's Clay Calloway. I'm a senior environmental health specialist at Maricopa County, and I worked in the environmental related illness program. And that is a small program of registered sanitarians that are dedicated to the environmental health component of illness investigations. What we do complaint surveillance inside the county. We do case investigations. We do outbreak investigations, help out with tracebacks, recalls. So doing environmental assessments for those investigations. And obviously that would be conducted on the county level. And then as things go into involving other jurisdictions, whether it's other local jurisdictions or the state or our federal partners, is we take that team that is kind of always stood up and running and plug that into that greater response. So on-site investigation where relevant, records collection, and really getting towards on-site control measure implementation. If there's control measures to be put in place, getting in there and doing that.
All right, thanks for that. We'll move on to our second question. What are the primary responsibilities and objectives of your RRT? And we'll go ahead and we'll keep following that same pattern as before. So we'll start with AZDA again.
Sure. So definitely the primary responsibility of the RRT is to address human and animal food incidences. And so with us still following a lot of what those grant objectives are for development, there are some very focused things that we do that are kind of the back end of it. I'm sorry, I have a cat that decides she needs to be involved in the meetings. And so we do have a lot of effort that we're putting into a collaborative framework. So kind of getting a little bit of that started before we start giving it out to departments to get full information, but creating a manual for us in the future for these responses. Additionally, determining some of our trainings that are needed for the involvement with this RRT. We've started that with a little bit of the trainings that they recommend. And so we've had some of those joint trainings with our departments, like Department of Health, and then also conducting presentations. So being able to come in, participate in these panels, do presentations at different joint meetings, just to give everyone in the nation updates on how the RRT is developing. And then more specifically within AZDA, our focus on the RRT right now is determining how we're going to truly respond within our own authority to assess potential risks as well as food produced in the state. Like brief overview. On to Reshma.
Thank you, Jill. Yeah, just tagging along to what Jill mentioned about, you know, especially the objectives, right? Our major objectives of the RRT would be definitely providing that timely response to outbreaks, and outbreak investigation is definitely a joint response. So definitely having that coordinated response, right? Making sure that we have that internal, external communications in place. And that's definitely something that we're working very close with Jill and our Department of Ag partners on, making sure we loop in the right partners at the right time. And I think the overall goal is definitely to protect the health of Arizonans, right, by mitigating any sort of risk that we have associated with, you know, outbreaks or environmental factors or any sort of implicated ag product. And then I'm going to kind of move into the responsibilities on our side. You know, we definitely monitor for clusters and outbreaks on our end, statewide outbreaks clusters. We review any sort of whole genome sequencing data. We receive reports from CDC, FDA that we review. So a little bit of different ways on how we monitor that. We have our automated programs that we run as well. And we provide partners as needed. So any sort of assistance they would need on outbreak investigations, case interviews, if they want to conduct any sort of studies like case control cohort studies, we definitely provide that assistance. And we're definitely responsible for reporting Arizona's outbreak data to CDC's National Outbreak Reporting System, which is also known as NORS. And coordinating, and this is something that I spoke about earlier, really coordinating with our internal and external partners where needed. And we also act as a liaison between our states and federal partners. So, any sort of questions that we need to communicate, inquiries, request that happens on the state level, we definitely kind of act as that liaison between our county partners, local health partners, and our federal partners as well. And during outbreak investigations, we attend any sort of federal level meetings, so CDC, anything that CDC, FDA, USDA would kind of organize outbreak related conference calls, providing. So during those meetings, we want to provide updates on the Arizona level. And we definitely bring some of those major important information updates from that meeting and then kind of disseminate it on our end. And when we kind of conduct outbreak investigations on our end, we have multiple jurisdictions involved in that outbreak investigations, we definitely kind of take the lead on scheduling meetings, kind of making that coordination between jurisdictions. So scheduling meetings as needed during outbreak investigations is something that we definitely take the lead on. And in case we need to distribute any sort of alerts or messaging statewide, we definitely kind of take the lead on those as well. So just wanted to highlight some of the responsibilities on our end as well.
All right, Utah.
Okay, so Talisha and I are going to kind of take turns on some of these questions so that we're not talking about the same things. And so I'll take this question. You can see that we part of the grant requirement that comes through FDA as you're developing your rapid response team is developing a best practices manual. And as we have developed that, it gave us a chance to all talk together, break down barriers, and help everybody realize that they're on a team together. It's while we each have our own expertise and responsibilities, it is a chance for everyone to work together to support responses related to outbreaks caused by human and animal food. This often means manpower and supplies and expertise to local health departments and to other jurisdictions as needed. And I think our main objectives are to shorten time between outbreak notification and responses, and to help build partnerships and meeting regularly with everybody involved in the food safety world and coming up with a way to work together, a way to talk through things as problems happen, I think is the greatest benefits that come through the RRT. And that's all I have for that question.
Absolutely.
And I guess just one more thing to just mention is you can see here that we do have a supply cache. We do house everything in a trailer so that we're mobile capable and we're ready to go with equipment and supplies when anything should happen. Thank you.
Oh, that's awesome. Pima County.
We do a lot of the same similar items, and we're just starting in our rapid response team. So having those meetings, we've always coordinated really well with our EPI team. We've recently included our EMAP and preparedness team in our monthly meetings, very similar to a lot of what was already stated. But at this point, we definitely are in the beginning phases of making that something more and stronger. But it is important to definitely have those meetings, do some hot wash exercises and roundtable discussions after a lot of our investigations or environmental assessments and anything, because it makes a bigger impact in how we move going forward, things to learn from and to do better. Definitely collaborating a lot with ADHS in some training, even in the middle of an outbreak response, getting guidance directly from ADHS and having that partnership as well. Working with all the different partners is important, and it definitely helps us to build our policies and protocols as we move on. I'll let someone else from the team speak as well.
Yes, so we've actually also implemented metrics from Partners in Health 717 in order to basically measure how we're responding to outbreaks in real time, and weigh that in with our administrators as well. And then also via frontline education when we go out with our environmental partners to outbreak sites, whether that's shelters or schools or other agencies in the community. Like I said, long-term care. We work with our healthcare acquired infection team as well, and we have an outbreak response team. So we partner within our own division and with our outside partners and with the state health department, like Lonnie mentioned. And so really trying to work both internally and externally and really be the face of the health department for educating our community on quick response and mitigation techniques.
Awesome, thank you. And then Maricopa County?
Yeah, I'll go ahead. Obviously, whenever you're in a jurisdiction that the public, those citizens, those stakeholders, they're going to be counting on you for protection from food, waterborne illness in that jurisdiction. And I think that kind of our primary responsibilities here are going to be that protection through detection of what is going on, assessment, and control. Those are our primary responsibilities. And I think that our team, because we're a small team, we get a lot of experience over and over again of different situations. We're also cross-trained to help out with emergency management responsibilities. So if things are taking maybe a form that you're not expecting, if you're used to just straight food or waterborne illnesses that wouldn't typically involve that emergency management response. Once you get one, it adds an extra layer of complexity there. Our team is able to handle that. We kind of see that included in our great list of responsibilities. And objective-wise, we look for good communication and cooperation through each response because it's very rare that you're going to do a response that is not going to involve other agencies. You're almost always going to be working with other agencies that are going to have their own responsibilities, their own objectives that they're bringing to the table. And a lot of times those are being pursued simultaneously. We're all relying on each other to fulfill those responsibilities, to complete that task. So objective-wise, communication has to be there. Cooperation, it has to be there. Otherwise, things kind of break down.
Absolutely, thank you for that. We'll move on to our next question here. Can you share a recent success story where your team made a significant impact?
Yeah, so with our rapid response team being relatively new, we still haven't had major events happen at this point. But within the first few weeks of me joining the team, we did have a little bit of involved. If you've heard me speak before, I always bring up the first positive salmonella test I got from another state, just because it did provide a lot for us to learn that I always view as a success. So this produce was tested in another state, and the other state, the other Department of Ag, reached out just to let us know so that we could start the process. They were very willing to tell us about their processes in these cases, as well as help kind of walk us through how we could handle it, whether moving into reaching out to the farm, whether it was kind of what they would do in a response situation, as well as for a recall. So that definitely was a good experience for us to learn what kind of questions we needed to have answered, as well as what we needed to start to develop for our team. It definitely helped us understand a little bit better what kind of notification channels we needed, who all got informed, and then who we needed to try and inform as well. It did make us reach out to some of our other partners, especially once we got a result. Definitely coordinating with our state agricultural lab. They helped us interpret a lot of those results, and gave us insight into their processes, should they have had a produce with the positive test and that we were reporting out, or if they did the testing themselves. So gave some of our processes a little bit more, make more sense. But then as well, I know I mentioned a little bit about trainings and doing the joint training with partners. Definitely that has been a big success on completing or making some of our relationships with partners a little bit better, made it so we all had to meet in person and struggle through any coursework. So we'll have more of that as everybody gets more cross-trained or more exposed to what it is that we're doing. And then I know I've heard of past things where there's lots of successes between the agencies working together. I just don't know them. So you may hear about some of those in the future of from the people that were involved, but that's mainly our successes.
Awesome. ADHS?
Yeah, so something that I want to definitely bring up, like Jill mentioned, I think our RRT is relatively new, but I think unofficially we've been kind of really working together with our, ag partners and as well as our county partners, our environmental health partners. So something that I wanted to bring up for this is our work and really close collaboration, coordination among everyone, including our county epidemiology, environmental health, Department of Ag partners, our environmental health partners here at ADHS, is the work during our 2023 cyclospora outbreak investigation. And I think, like I said, I definitely want to emphasize that close collaboration. We definitely worked very closely with Maricopa County as well as Pima County during that outbreak investigation. Unfortunately, I think we definitely kind of experienced a lot of challenges. We weren't able to identify a suspected vehicle for that outbreak, but I think definitely want to highlight the strength of how quickly meetings together and kind of talk through the next steps and talk through the investigation. We were definitely we're able to rapidly involve our Department of Ag partners as well. Though I think it was a transition period of the Yuma growing season, but I think we were able to kind of get our partners early on into meetings and kind of that collaboration was very much early on. And we definitely conducted a hot wash for this investigation as well. And I think communication was something that was really highlighted as in strength. So definitely wanted to bring this up for this discussion. And in addition, I think I wanted to bring up also, few of the trainings that we've conducted this year, one of them being the applied outbreak training that we conducted in collaboration with the Colorado Food Safety Center of Excellence. And this was, attended by our county epidemiology, environmental health partners, as well as our tribal partners. We had some attendance from our state health laboratory as well, and our environmental health partners. So I think we kind of went through trainings on outbreak and response, that step-by-step process for outbreak investigation. And I think something that was really enjoyed by everybody. And I think it was well attended and something that definitely we consider as a success. And the other training that I wanted to definitely bring up was we host our Arizona Infectious Disease Conference every year. And during 2024, we conducted a foodborne tabletop exercise that was on botulism outbreak. And this was also attended by our tribal partners, county partners. We had some providers, infection preventionists, lab partners, our epidemiology partners, and our partners from poison control as well. So, we kind of went through that botulism outbreak scenario. And I think the overall goal for this tabletop exercise was to definitely educate everyone on botulism, but, kind of understanding everybody's workflows was very helpful as well. With botulism, there are those specific requirements on sample collection, etc. So I think it was a really good success that we were able to get all our partners together and work through these scenarios. We definitely had preparedness questions as well. So that was very helpful to know what everyone's process is, where everybody stands. And we just finished working on the after action report, and there are some action items that were resources that we need to highlight on our end, resources that we need to develop. So I think that's something that's on our next steps to do through this exercise, and definitely a success that we consider. So I think those are the things that I wanted to highlight.
Thank you. Utah.
Yeah, I'll take this one. I'm just gonna show you a couple examples of one particular success story that we recently had. So we had a STEC 0157H7 outbreak in one of our local communities last year, where the URT and our steering committee provided significant sampling resources and expertise to lead that outbreak stream, which was found in the city's pressurized irrigation water less than 2 weeks after the outbreak was first identified. And so this allowed the Utah Rapid Response Team to help the public health to identify the source, and also the outbreak to help the public take steps to prevent illnesses. So you can kind of see some pictures on this slide of the process. And then we also were able to, there's a isolated outbreak or incident, I should say, of thallium. So we were also able to respond to that. And then we also had one of our local health departments had an outbreak of Salmonella Livingstone earlier in the year. And so this outbreak was associated with a restaurant and the local health department, and they didn't have the experience or the supplies to be able to do a full environmental assessment. So the Utah Rapid Response Team was able to provide sampling, supplies, and guidance to be able to facilitate a environmental assessment. So with the help of the Utah Rapid Response Team, the investigators were able to get multiple positive environmental swabs from the facility and identify cross-contamination as the likely source of the outbreak. So this also helped identify important areas for remedial cleaning. And then there's also since then been no future incidents or cases associated with this restaurant. And due to this, we also are doing an environmental assessment training for our estate coming up in March. So that's all I have for that question.
Pima County.
Talking about salmonella outbreaks, we investigated one in 2021, a salmonella branderec that eventually was linked to a local restaurant, similar to what was just spoken about. And that really launched our, on both the environmental and the epidemiology sides, kind of processes of investigation, outbreak investigation. It was originally ADHS sequencing notified us of a cluster with some similar demographics. Later, we found that it was ended up being folks eating at the same restaurant. And this was a recurring outbreak that EPI and EH addressed. And then in about May and then around October, as we were going to present at the same conference that year, they had a recurrence. So we were able to address more of the root causes and the deep cleanings needed. Shane, if you want to talk about the environmental side.
Yeah, so this was all a new process for us. We hadn't had any sampling procedures in place before any of this happened. We worked really closely with Arizona Department of Health Services. They actually brought down one of their staff members to come down with us and supplied us with testing supplies and directions on how to transport it to a lab and everything like that. So it was a huge learning process, and we actually kind of developed this sampling process based on like multiple, sometimes like trial and error, coordinating with the lab to get like a courier to come pick up samples, things like that. So now we have just the complete training process in place. We do, like, whenever our swabs expire, we started like training new staff with like expired samples and things like that, so we can try and get everybody on board and are prepared for any other time that we will need to go and do like environmental sampling. Um, there was also some learning curve with the cleaning process for the facility. They hired professional cleaning companies that wanted to use like certain chemicals and certain processes, like an electrostatic cleaner to try and clean it, and that didn't work. So, the sampling was super important during this because if we weren't doing sampling, we would have just let them reopen after they said they cleaned. But then since we were able to work so closely with the state and find out like all the sampling procedures, we were able to make sure it was fully tested negative before they were able to reopen.
And Epi and our environmental team were on the ground with the restaurant when the occurrence was identified to and how serious it was, to assist them in the restaurant of getting rid of equipment that was contaminated and could not be cleaned adequately, preventing any further recurrence. So very much a partnership with that restaurant to show that we, we're not trying to shut them down. We're here to support them to be able to carry out and not make folks sick. We also investigated, I believe it was maybe the same year or the next year, a sudden outbreak of toxin identified in food that was served kind of buffet style to a population of refugees in Tucson. It came up very fast. It was, I believe it happened on a day that we were not working, on a weekend day. And so we were able to get on the ground once we were notified during business hours and get out there. Our director notified us to test samples, get samples from individuals living in this hotel for recent refugees. And Epi was able to go in and use translation services as they, most of them did not speak English, and do case investigations, gather information and data on foods that folks ate, narrow things down from there. And then our environmental team worked really rapidly to get samples tested at the state. I believe it was the week of Thanksgiving, so very, very tricky time. And they drove up there, and the state worked with us, the lab, to get things identified. And we also were able to provide education to groups cooking. Chefs went in and worked with the folks who had been volunteering to make sure that there was that the folks who would be making the food for this group were doing it safely, or that we could identify folks who would do it safely and provide education around that too.
Thank you, Gretchen, for sharing. Just wanted to add to that, the volunteer group that was preparing the food were preparing it in a residential kitchen at a home. So that became a concern or issue in terms of education and proper preparation, and the language barrier was definitely challenging. We also had some concerns in learning how much of a product that was needed for sample sizes. So there was a lot of learning things within that experience, but it did help us to develop our internal processes in terms of how much is needed for a sample size, and the interpretation piece was critical during that. At that point, we were also contacted by law enforcement. Just many different factors came into play related to the refugee community and that massive GI illness for that population. So it was a lot of work on all ends, and we were at least able to confirm what the food product was, but definitely a lot of good information came from that to build our process moving forward.
Thank you. And then Maricopa County.
Sure, I'll share quickly here. Reshma, you did take my example that I was going to use for cyclospora. That was last summer. It was a little bit before the explicit RRT language kind of came up, at least for me. But like you said, I think we were doing a lot of those, the aspects of that framework already, especially since a lot of this for environmental health wise gets built on top of program standards and C4. But that cyclospora outbreak was really a stress test. It was kind of one of the more complicated responses that I've been a part of. I think that in the state, we had about 60 cases of cyclospora within that 2-month window, about there. And we had multiple counties. I think it was 4 or 5 different counties that were all involved. And I looked up that outbreak response just a few months ago, and I kind of forgot how many other cyclospora outbreaks were happening in the United States at the same time. So there was a lot of stress on this group of people that's supposed to be responding to this outbreak, a lot of question marks, a lot of really kind of discussing back and forth on the direction where things should go. And I think that we performed really well during that response for what we could do. Now, there was difficulties, the pathogen case definition difficulties, lack of a clear food vehicle. But despite all of those things, I think that because we already had structure and framework of, all right, this is your position, this is what you contribute to this response, here's what you need to be trying to get, here's what you need to be doing. Because of that, between EPI and environmental health and even the permitted establishments involved, I think that we were able to have a successful multi-jurisdictional response. Doesn't mean that we don't have lessons to learn from those events. We do, certainly, we did. But all of those things are going to happen. All that collaboration is probably going to happen anyway if you don't have these setups, but it's going to take longer. And in these situations, you really want to minimize the amount of time from the alert to the actual control measures. So I think the big success was having that framework, having some of that structure where you can just kind of pull the trigger and execute when the time is right.
Thank you. All right. What strategies has your team implemented to improve response times or effectiveness?
Yeah, so I'll go into a very brief history. So back in 2018, there was a pretty big romaine lettuce E. coli outbreak that was traced back to Arizona. So that one, it did take the FDA quite a few months to actually get boots on the ground to do some sampling. And so that actually kind of caused us to improve our response times. Arizona Department of Agriculture gained on-farm regulatory authority in August of 2019 so that we could truly go out on the farm, start that sampling or that response quicker than the FDA would have been able to. And then it was also our constant communication with them to try and get this team so we had the authority for the team. It was the rapid response team is normally eligible through different programs. And then finally, we were able to get it through our produce safety role. And that made it so we could start the process, get that improvement of response in the case of produce grown in Arizona. But for our day-to-day improving our response times is definitely, as you've heard, meetings, bi-weekly meetings and regular meetings with our agencies just to discuss things, get additional situational awareness, and just keep everybody informed, because it makes it so that we all can respond a little bit quicker the sooner we know something.
ADHS?
Yeah, so to improve some of our processes, in terms of like timeliness and effectiveness, we've definitely put together a process map, between us, our EPI team and our environmental health team, which has really helped our, workflow, ensure, we have that clear communication, ensure we understand our roles. And I think that has really been definitely a strength with our communication flows. And like as with our RRT being new, we're definitely working on expanding that process map, I would say that flow, to include our, communication and coordination with our Department of Ag partners. So, that's definitely work in progress. We also meet with our EPI and our environmental health team and the ag partners twice a month to discuss any updates, projects, activities, We keep each other kind of informed on any major outbreaks that's going on, updates, major projects that we're working on, trainings we'll be attending. And I think that has been really, really helpful to stay informed, but also, discuss any gaps, issues, challenges that we come across. And I think that's been helpful to kind of navigate some of those challenges and issues. And something that we could improve. And something, specific to our EPI program is, we've developed some automated programs on our end to set up, to mentioned before, some of those notifications kind of come in different ways, but I think something that we've developed within our program just to kind of stay ahead and making sure that we get those timely notifications of clusters, and that way we can respond in a timely manner. And also we have, visualizations like dashboards to monitor our cases and, to monitor trends and any increase in cases. So if we, and we compare that with the past data, the data that we're seeing, seen in the past 5 years, and compare that and see if we're really seeing that increase and kind of taking that next steps of, informing our county partners, making them aware as well of the increase and taking those actions accordingly. So I think those were the things that I wanted to highlight on our end.
Looks like Utah's ready to go.
Okay. As you can see, RRT, the T stands for team. And I would just want to say, one thing we really tried to do is break down the silos. When we all get together and we talk about our needs, we all have different expertise, whether it's health departments or Department of Ag or the lab. Everybody has a different role they play, but when it comes to an outbreak, we break those down and we work together. And we exercise every year. We have some kind of an exercise. During COVID, it was a challenge. How do we do this kind of work where we've got to go out and sample and work together in a setting that's a little more hands off, like during the pandemic? And so we exercise that. How do we do that? We identified the need to learn about traceback, so we put together a special traceback training exercise. And then last year, we decided we wanted to take it from the beginning to the end. So when we find out that there's a problem, we did a lot of fun things with this to keep it interesting and keep people engaged. But where was the problem? Tracing it to a source, and then actually going on farm and having in-field exercises on the ground where we actually got to look at possible places where problems could exist and talk to workers and do interviews and test out our temperature controlled tent. It was over 100 degrees, and so how do we do that and stay safe and not get sick? And how do we interview people so that we get the right questions and asked? We went through the whole process, and it was a really fabulous way for people to understand how we work together in an incident. And just last thing, if Alicia would go to screen number 10, our outbreak template. One of the ways that we really work together is we've developed a system. When something happens, we get together and have a quick meeting, and we go through the problem of what is it, what is the epidemiological background information, what's the current update, and then we have this activation level that kind of says when things are bad, how bad are they, and what do we need to do at this point? And it helps us hone in on where things are at. Now, things can escalate quickly, and so that may change, but this helps us understand where we're at. We always go out with a combined message so that Department of Ag and Department of Health or the lab aren't sending out disparate messages. It's the same messaging, and we work with our state PIOs for that. So when it comes to implementing strategies to become effective, I think those are our things that have been most effective for Utah.
I love the slides and the graphics are great. Pima County.
So as I mentioned before, we've implemented our 717 metrics. So basically those metrics have helped us ensure timely response to outbreak mitigation in terms of time to detect an outbreak, time to respond to an outbreak, and the time required to do those mitigation efforts, including education, whether it's sampling, further detection, and again, education, collecting line lists, notification to our partners. And so that has helped us really hone down our response time, and it's helped us capture better data over time as we've looked across the years. And so I think with training and looking at these other agencies doing the same things, working with our EMAP or preparedness programs, and hopefully trying to get those trainings out collectively with our environmental health team to work on continuing to do those in different areas. So I think that's something that we will continue to be doing as well.
And then Maricopa County.
Sure thing. Yeah, I think I said this earlier, is kind of each investigation is informed by the previous responses, both good and bad. And one of the things that we've been able to do to kind of improve response times and effectiveness is really thinking about the other agencies that we work with. And when you work with those agencies and the same people in those agencies over multiple different kind of sets of circumstances, you almost begin to predict their needs a little bit, or if you know kind of aspects of their job that are important to them that they're going to want to have handled. Like, so for example, sometime last year we had a salmonella investigation that took our team to a daycare facility early on in the month, and the investigation request at the time was limited. Even though it was limited, even though not everything was requested, we went ahead and collected menus for a certain time frame because we kind of have an idea of those other team players that are in a greater response. It's like, okay, this might be something that's helpful to someone else later. It's not necessary for our investigation that we're doing necessarily, but we're going to hold on to this. So in that circumstance, we collected menus for a time frame before the onset of the case's symptoms. And they weren't requested by anyone. We could have just reviewed them on site and left them there. But thinking about those needs, thinking about those things, and kind of learning from past responses as we took those. It's like, hey, somebody might need these. Later on in the month, that investigation became part of a larger investigation, and those menus were requested. And instead of having to go and make a separate visit, go back to the facility, spend a day out in the field, collect that information, it was something as simple as dragging and dropping on Food Shield and sending that off. And these things might seem like they're small, but in a response, all of those things are going to add up. And going back to the time from detection to the time that you can put control measures in place, we see little victories like that. If you can provide, you can kind of do your duties in a faster amount of time. That's a good thing.
Awesome. Yeah, I love that proactive, comprehensive approach. We do have more questions. Unfortunately, we are running very short on time here, and we do want to have at least a little bit of audience participation. Rather than do like the roundtable format, if anybody from any RRT wants to pop in and just give an answer to any of these questions, how and when is the decision made to enter a response mode?
I'm like, it depends. From everything I know I've read, and probably Talisha or Thane are way better at giving this answer for rapid response or RRT response. But it can be local and the local decides to respond. It can be statewide, so then the state gets a little bit more involved. But then, of course, as soon as it gets multi-state, it becomes just a bigger thing.
Absolutely.
I'll just chime in real quick. We work really closely with our steering committee, so we never just go in and respond to any incident. We're not there to take over anything. We're just there to assist. So before we respond, we've had lots of meetings with a lot of partners, who might be involved in the incident, and then we have a lot of team meetings, and then we just all respond as a team.
Awesome. And I think this one might be a little bit shorter, so I think we maybe have time for one more question. Specifically for Jill and Talisha, how long has the RRT been implemented in your state/department?
So for Arizona, we got awarded the grant in 2023. You get a 3-year development period of time. There are 3 other states in their developmental phase. I believe it's Arkansas and Tennessee. I know for sure Arkansas. I don't know about the third one for sure. And then I know I did see if there's other ones involved. So we do have 2 of them here, and I believe it's up to 26 total in the nation. But definitely the West Coast has less than the East Coast.
That's
And then
go
I'll just answer this one briefly, and then Thane can chime in, because I'll probably forget some details. But I believe that the RRT started in 2019 in Utah, and Thane and Rick Beckstrand, who's now retired, actually started it in the state of Utah, and then I came a year later. But real quick, we also oversee our food safety task force as well. So
awesome.
go
Sounds
ahead,
good. Thank
Thane.
you. All right. Unfortunately, that does wrap up our time for this presentation. If the audience has any further questions, they might be able to put them in the Zoom chat. Maybe if some of the presenters or if they have time, maybe they could answer some of those for just a couple minutes. I do really want to thank you guys so much for taking some time out of your schedule and for preparing your questions, preparing, just representing your response teams here. And we really, really appreciate you guys sharing your wealth of information and experience. So thank you. Thank you.
Thank you.